One of the greatest things I find about the multidisciplinary team is that we're all professionals looking after the individual, so our focus is on the patient and we all bring something different to the table.
We can listen to everyone's opinion about the treatment, the likely impact for the patient, and we can ensure that treatment is going to be the best for that individual patient.
It gives the patient a holistic view of how they are going to be managed.
Multidisciplinary care, particularly with head and neck cancer, is very important. The health professionals are all in one venue reviewing this patient, and the communication is improved greatly. Their access to treatment and the shorter time frames to having treatment is improved greatly. The nurse specialist role involves the management of patients with complex care needs. Importantly, being a consistent point of contact for the patients and their carers.
At our initial consultation with the patient, it's largely about informing them of what's going to happen to them with regards to their teeth and also assessing the condition of their teeth at outset. Sometimes that might mean removing some teeth or doing some interventive treatment for them. There's no cookie cutter recipe really in treating these patients. Each patient's considered by the team individually on the basis of what they're presenting us with, and that correlates with better patient outcomes and better patient satisfaction at the end.
A radiation oncologist prescribes and ultimately takes ownership of the whole process of delivering radiation therapy to patients. There's often no right or wrong answer about what the best thing to do is, and we need many medical minds put together, as well as our allied health colleagues, and work out what's going to offer the best chance of cure with the best functional outcomes. Hopefully the patients are feeling confident that a holistic decision is being made.
Well, since nutrition is so important in patients with cancer, it's very important that we have nutrition advocates in that multidisciplinary team. Part of my role is also the recommendation to the team as to when I feel that a patient needs to start using a feeding tube to meet their requirements if they can't get enough in through their mouth.
As a surgical pathologist, I look down the microscope and at tissues from patients with head and neck cancer and decide what type of cancer it is, and then whether that type of cancer is best treated by surgery or by chemotherapy or by radiotherapy or requires some other form of treatment. The aim is to get the most accurate diagnosis and then plan the best possible treatment.
Speech pathologists look after patients with communication and swallowing problems. Working as part of an MDT ensures coordinated approaches to the care that we're able to give patients.
When you're having a cancer diagnosis, is an emotional experience. The multidisciplinary care ensures their emotional well-being is also taken into account. There are access to psychosocial support within the multidisciplinary team, such as a cancer psychologist or the social work.
It's quite overwhelming for patients initially, but having a team who obviously know what they're doing, who do this all the time, who communicate well together so that we give really consistent messages to our patients, I think it makes the treatment journey much easier for patients.
They can go to any of us about any issue, and they know that as a team we will have a discussion on their behalf to ensure that they're getting the best treatment possible.